fibers inhibit the pain transmission to the brain, and so the pain should be decreased.
What mechanism inhibit C and stimuli?
Not inhibit C. They are filling the gate. Filling the gate. There is no other way to pass the C fiber because the A fiber message reaches sooner. Okay?
Doctor, the A fibers is for the sensory of the skin and superficial.
No, not just in that. I explain it for you later. A fiber is on the skin as well as in the joint.
Okay, so
I prefer to talk about them later. There is 4 receptors, joint receptors in the joint, that the message of these joint receptors should be transmitted by the A fiber, like to the sensory input.
So why they stimulate together A fibers and C fibers?
Okay, by mobilization techniques. C fiber is stimulated by the pain of the joint. For example, I have a pain in my joints. A fiber is stimulating regarding to the joint proprioceptive receptors. And by mobilization, I activated these joint receptors in a joint. Okay? And then A fiber is transmitted and close the gate. Okay.
So, doctor, so by stimulation of A fiber, the C fiber will inhibit, right?
Not inhibit. Not permitted to pass from the gate. Inhibit is different. For example, secretion from transmitter to inhibit the C fiber. It's just close the gate and pass easier, and so C fiber stay behind the door, behind the gate, and cannot move.
Just A fiber signal will move.
Yes, it's a mechanism. You have an experience. If your hands have hard in the trauma to one places, you put in your mouth. Why? Because this sensory stimulation transmitted by A fiber and so diminish the C fiber transmission. Or put this spot. You have a massage on the places that should be have a trauma. And for this manner, the pain should be decreased. Why? Because the A fiber is activated. All right, tense. Okay. It is better to, first of all, I talked about osteokinematic and arthrokinematics to better understanding the nature of the mobilization techniques. And then we talk about these joint receptors inshallah in the next sessions in details to better understanding the effects of the mobilization techniques. You know that there is 2 types of movements. I talk about osteokinematics and arthrokinematics. Osteokinematics is the main movements in our body, like for shoulder. Abduction, adduction, flexion, extension, external rotation, internal rotation. In contrast to osteokinematics, we have another type of movements that dominated as arthrokinematics or sometimes accessory movements. All of them are synonym. Accessory movement, joint plane movements, arthrokinematics, all of them have a similar meaning. And what is the meaning of arthrokinematics?
Movement inside the joint.
Yeah, inside the joints, between the bones, not regarding to the lever arm and providing the momentum of the rotation. So there is different type of the arthrokinematics, like rolling, sliding, spin, compression, and distraction. That all of them named as accessory movement or joint plane movement. In different books you can find different terminology for the arthrokinematics. In the arthrokinematics, there is 3 main types of movement. Distraction, compression, and translation. That translation should be done in different axes. I talked about it before. It is a distraction. You can see, for example, it's a shape of the joint and it's providing distraction from this. Distraction. All of this is distraction. If I try to close two parts of the joint together, it is compression. Yes. About the figure.
So, Dr., what's the